For the very first time, if you're searching information related to hair transplant on the internet and you're short on time but want the complete information in a nutshell, then this primer about hair transplant is just for you.
Okay, let's play a game, the alphabet game. I will say one letter and then I'll say a word that starts with that letter. So if I'll say C, maybe I'll say car. Okay. Here we go. A like
So let's take it up one
angel.
alphabet at a time. Since the topics are covered very briefly, the entire information about hair loss treatment, hair transplants cannot be given in one video. So I have so constructed this video for maximum information as I go along the alphabets, the 26 alphabets. For those who want to research more, there will be a link on my left-hand corner of the screen and on your right-hand corner, a link which will lead you to a greater detail on that particular topic. So let's embark on the alphabet journey.
B like big, C like cool, and D like indeed, E like in Easter, F like foot.
So what is alopecia? Alopecia plainly and simply refers to any form of hair loss which can occur over the scalp or any other part of the body. And it encompasses various conditions like androgenic alopecia, alopecia areata, scarring alopecia, and so many others. Understanding the type and the cause of alopecia is critical in determining the type of treatment that the patient is going to get, medications, whether the patient is fit for hair transplant surgery or not, does he need to bring in certain lifestyle changes in his life. And as you all know, alopecia can significantly impact a person's self-esteem and quality of life, making it a crucial focus in hair restoration practices. And then we come to baldness, a type of alopecia. When we call somebody bald, the term baldness more often than not refers to male pattern baldness or androgenic alopecia. And this can occur both in men and in women. Male and female pattern hair loss occurs due to the sensitivity of the hair follicles to the circulating DHT hormone, the active form of testosterone. And remember, it is the sensitivity of the follicles to DHT rather than high levels of DHT which are responsible for androgenic alopecia. And usually androgenic alopecia is ever progressive, the degree of progression depending upon the penetration of the gene in your DNA. And this is greatly variable. Eliciting family history will give us a clue on where your baldness is headed. Before understanding any form of hair loss, be it forms of androgenic alopecia or plain simple alopecia, it is very important to have a basic understanding of the hair cycle. The hair has three phases. One is the anagen phase, fully florid stage in which the hair are thick, robust, the hair shaft diameter is thick. And then we have the catagen phase or the transition phase in which the hair are progressing towards telogen phase, and telogen phase is the resting phase in which the hair are not visible on the skin. Understanding this hair cycle is very crucial in treating various patterns of hair loss. Disruptions in this hair cycle can lead to conditions like telogen effluvium, a condition in which disturbingly disproportionate number of grafts fall off all at once from the scalp. And the follicles which have shedded their hair go into the resting phase or the telogen phase rather prematurely. The usual donor area lies at the back of the head and on the sides, which is considered usually as being permanent. It is referred to as the safe zone, safe for hair transplantation since it contains follicles which are permanent in nature and will withstand after transplantation the effects of DHT for a very, very long time. The permanency of the safe zone forms the basis of hair transplant surgery. Androgenic alopecia rarely, if ever, involves this safe zone which is at the back and the sides of the back of the head. But rarely when it does, this severe form of androgenic alopecia is referred to as diffuse pattern alopecia, and you can click on the link above to get further details. Now, very often we refer to the hair at the back of the head as being permanent. It is not wholly permanent, please understand that. The use of the word permanent is a metaphor, a figure of speech, which refers to the rather long life of the hair taken from the back of the head and the sides. The fact of the matter is that hair taken even from the safe zone will continue over a period of time to be affected by DHT, in some people more, in others less. And definitely as you grow in age, the thickness and the density will decrease over time. Nothing in this body is permanent. Nothing in this body is eternal. And to expect hair to last a lifetime is but a flight of fantasy, not grounded in reality. Falling for slick marketing and slick scientific talk has often led the unsuspecting hair loss sufferer down the garden path. Aggressive marketing makes you believe in myths rather than in hard scientific facts. Besides the scalp donor, grafts called body grafts can be harvested from various regions of the body. And these include the beard, the chest, the groin, and also the upper limbs and the lower limbs, provided the hair are of sufficient caliber. Ensuring a healthy and viable donor area is of utmost importance while doing a hair transplant surgery. Everything depends upon the quality of hair that are being moved from the donor area to the recipient area. The number, the quality, the density of hair in these donor areas is going to determine the number of grafts that can be harvested and the eventual outcome that you're going to get through the hair transplant procedure. Moving grafts from the donor area to the recipient area is like robbing Peter to pay Paul, but at the same time ensuring that Peter, though robbed, does not mind it, does not carry ill feeling. Moving grafts from the donor area to the recipient area without making the donor area look over-harvested. The donor area, though depleted, should look just the same as it was before the procedure was done. When life pulls the rug from below your feet, the hair soon follow. Stress, illness, nutritional deficiencies, and a host of other conditions can lead to telogen effluvium. The term telogen effluvium denotes disruption of the hair cycle. A significant number of hair follicles fall off entering into the telogen phase or the resting phase, and all this all at once. Recognizing telogen effluvium is essential for providing appropriate reassurance, appropriate treatment to the patients, and it often resolves on its own once the underlying cause is addressed. Now coming to the topic FUE versus FUT, the debate that used to be there about a decade back. Now not many people talk about it, but since I'm doing a primer on hair transplant, it is important to mention the FUE versus FUT debate. If you are going in for a hair transplant today, more likely than not, it's going to be FUE or follicular unit extraction or excision as some people may like to call it. FUE comprises 97% of surgeries done in hair restoration the world over. The chances of your getting an FUT surgery or follicular unit transplantation is rather bleak, just about 3%. FUE and FUT are two methods of hair transplantation. While FUE on one hand involves cherry picking of the good quality hair, the most robust hair, the hair in the prime of the health, only follicle units in the anagen phase. On the other hand, FUT involves harvesting a complete strip, a strip which contains hair in all three parts of the cycle. That is hair in the anagen phase, that is hair in the catagen phase, and that is hair in the telogen phase. It is obvious that patients seek out FUE over FUT because it causes less visible scarring if done in the right hands. Also, since a piece of skin has not been cut, the recovery is quick, the downtime is less. FUE also affords us the luxury of exploring other sites in the body for FUE graft harvesting. So combining FUE from the scalp donor, FUE from bodily areas like the beard, the chest, and other parts of the body allows us to explore a limitless donor area all over the body, which FUT does not. So as an analogy, let's compare the two techniques with how a farmer picks ripe apples from an apple tree in his orchard. The most effective and economical way for him, without wasting any apples, is to pick the most ripe, the most luscious red apples one by climbing up the tree on a ladder, leaving unripe apples for a later harvest. On the other hand, if he is in a hurry, if he is not skilled enough, if he is not mindful about wastage, he will just merely shake the branches of the apple tree rather vigorously, and all the apples, ripe ones as well as the unripe ones, will fall to the ground. Look at the immense wastage of apples. A waste of precious commodity, an uneconomical way of farming. So if you think that this analogy, comparison between harvesting apples from an apple tree, comparing it with FUE hair transplant, has substance, drop a note to your FUT surgeon. Ask him why the farmer wastes so many apples. Ask him why the farmer does not pick only the apples that can be consumed. Why can't the farmer just pick ripe ones and come back for the unripe ones later when they ripen up at a later date? Why does the farmer not use a ladder? Why is he depleting precious resources? However, FUT surgeons are slowly switching over to FUE, a reality that they could not escape from. The past is another matter when they considered FUE hair transplant surgeons as pariahs of the specialty. There was one very well-renowned hair transplant surgeon of about 15 years back who referred to FUE hair transplant surgeons as the heathens of the specialty. But when you keep in mind that hair transplant is one of the most fiercely competitive field in medicine, you will realize that every doctor attempts to ferociously preserve, guard, and dominate his territory of whichever technique he is doing through an innate animal instinct. And that is the reason FUE as a hair transplant technique, as a specialty, was denigrated for almost over a decade by FUT surgeons. Now coming to grafts, what is a graft? Once a hair follicle is extracted from the scalp donor or any other donor in the body, once it loses its blood supply, it is referred to as the graft. The number and quality of grafts are crucial towards achieving a good hair transplant result. A graft can contain 1 hair, a graft can contain 2, 3, and at times 4 hair. And their meticulous placement ensures density, a natural look due to proper hair direction. Ensuring the survival and growth of the transplanted grafts is a key objective of every hair transplant surgeon, involving careful handling, precise placement, and follow-up care. Harvesting is a process which refers to the removal of grafts, the excision of grafts from the donor area. It can be either manual or it can be motorized. The skill and technique used in harvesting significantly impacts the survival of the grafts and overall success of the hair transplant. Proper harvesting without trauma minimizes damage, ensuring better graft survival. Graft survival is the key to achieving a natural and a satisfying hair transplant result. Incisions are slits or channels made in the recipient skin where the grafts are going to be inserted. The angle, the depth, and the distribution of these slits are critical for ensuring density and a natural look. Precision in making these slits ensures careful placement of the grafts to avoid damage to existing hair, native thinning hair, and at the same time ensuring proper graft survival rate. If slit making is not precise, if slits are not made parallel to one another, if there is cross communication between slits because the hand moved, the hand was not stable, this will lead to poor hair growth. Slit making is an important aspect of hair transplant surgery, just like harvesting is. And these are the 2 steps which are considered surgical steps of hair transplant surgery, and only the surgeon is allowed by law to perform these 2 steps. But as we all know, the reality is very, very different. Very few doctors do hair transplants themselves. So at this point, you must check whether the doctor is going to do the surgical steps, the incisions, the harvesting, and the incisions will be done by the surgeon. The hair loss journey involves the progression of hair from normal to thinning hair and later a full-blown baldness over several stages. And this follows often a predictable pattern, such as the Norwood scale for men, and this is dictated by the genetics of the person, the gene he has inherited. Every person in whom baldness strikes is not going to end up in grade 7. The final grade is determined by your genetics, your family history, also modified by epigenetics or environmental factors which have a great bearing on the expression of the gene. And understanding this timeline and the ways to control further progression of baldness, even if you're destined to grade 7, helps us in planning appropriate interventions. Early stages of baldness may benefit from medical treatment, treatments like DHT blockers, minoxidil, salient lifestyle changes, whereas advanced forms of baldness will always respond only to surgical hair restoration. The patient's psychological and emotional journeys are also very significant, and it calls for compassionate care, understanding the objectives of the patient and giving him support, explaining to him what can be realistically achieved and what cannot. The next hair transplant journey is undertaken after the hair transplant. The hair takes time to grow. Hair transplant, after all, is not a sprint, it's a marathon race. Pacing and perseverance are key. Now, research before a hair transplant is key to choosing the right hair transplant surgeon who can deliver what he promises and deliver them with natural results, proper density, and follow up the result for a longer period of time to keep further appearance of baldness at bay. Similarly, knowledge of hair transplant by the doctor is crucial. The skill, the knowledge, updated knowledge by attending seminars, attending society meetings, interacting with peers and seniors is crucial in the career of a hair transplant surgeon. For a well-informed hair transplant surgeon can tailor treatments, customize treatments according to the patient's unique condition. Every baldness is not the same. Every mindset is not the same. Every patient does not similarly respond to medication. Only holistic care can ensure long-term survival of hair and long-term patient satisfaction. So, as a patient, look for a hair transplant surgeon who's either a plastic surgeon or a dermatologist, because only these two specialties are trained to do hair transplants. A hair transplant surgeon who does only hair transplant surgery, and more likely than not, if you follow this dictum, you will seldom, if ever, be disappointed. Local anesthesia, lidocaine, is used to numb the scalp donor, the bodily donor, and the recipient area. Pain after hair transplant is minimal. It is a rather comfortable procedure because of the benefits of anesthesia that we have today. Needless to say that the administration of anesthesia should be done carefully. One should know what drugs you are injecting into the body, because drugs have a toxic effect on the heart, how much dosage to give, over how much period you can give anesthesia. The understanding is very important if you do not want to land up with complications. At times when the patient is anxious, a little bit of sedation does help in relieving the patient's anxiety and allows the surgeon to undertake a smooth hair transplant procedure. Just like an eagle cannot hunt without an eagle's eye, the precision of hair transplant surgery without magnification is seriously constrained, for you can only do what you see. During a hair transplant procedure, we are dealing with grafts which are less than 1 millimeter in size. It is impossible to handle them without causing injury with the naked eye. Without magnification, the naked eye is bound to make mistakes, blunder, damage follicles. And the damage can be immense, putting at stake the survival of the grafts, leading to suboptimal outcomes. Magnification devices like 4x magnification loop, 12x magnification for graft dissection are essential for hair transplant surgery for precise harvesting and dissection of these follicular units on the table. Also, for making slits, magnification is crucial. High magnification allows for higher accuracy, minimizing damage to the hair follicles, ensuring optimal placement of grafts into the recipient area. This precision is essential for obtaining natural-looking hair transplant results, besides high survival of grafts. So these advanced magnification techniques can enhance the overall quality of the hair transplant procedure and outcome of the results. The Norwood classification is a widely used system to categorize the stages of male pattern baldness. For females, we have the Ludwig scale, but let's talk about male androgenic alopecia for now. So it ranges from type 1, that is mostly like normal hairline, ranges up to type 7 male pattern baldness, which is the most advanced form of androgenic alopecia. This Norwood classification helps us in staging the hair loss, in diagnosing the extent of hair loss, planning treatment strategies, and setting realistic expectations for the patient. So this is a valuable tool for both the clinician and the patient in understanding the progression of male pattern baldness and the potential outcomes of various treatments, also in documenting archival of the cases. Oral finasteride and topical minoxidil are FDA-approved treatments for hair loss. While finasteride inhibits 5-alpha reductase enzyme, preventing the conversion of testosterone to its most active metabolite DHT, DHT has an ill effect on the follicles, and this is determined by the male pattern baldness gene. So it inhibits the formation of DHT by suppressing 5-alpha reductase, and this slows down future hair loss. Minoxidil, on the other hand, is a vasodilator. It increases the size of the vessels of the scalp, bringing in more blood supply. It keeps the hair thick as long as they are there on the scalp, but it does not prevent progression of baldness. Stopping progression of baldness is a factor which is the responsibility of finasteride, a DHT blocker, and not of minoxidil. While using minoxidil, you may have thick hair, but your baldness will continue to progress to its final predetermined stage, which in the case of finasteride, you can greatly constrain. Understanding the mechanism, the benefits of various medical treatments available to us, their side effects, where they can be used, where they cannot be used, is essential for tailoring customized treatment. And I have done a number of videos on hair loss treatment for men and women, which you can access here. Punches are tools, cylindrical tools that we use to harvest the grafts. And these may vary in quality, these may vary in size. The most commonly used punches are between 0.7 millimeters and 1 millimeter in diameter. Punches may have serrated edges, flared edges, round edges, or dull edges. The choice of the punch by the surgeon determines the quality of a hair transplant result. Needless to say, smaller punch sizes will cause lesser scarring, but smaller punch sizes will also slow down the harvesting process because it is more difficult to harvest a graft when the punch size becomes lesser, which is almost the size of the diameter of the punch. Punch diameter should be just a fraction larger than the diameter of the follicular unit you are aiming to harvest. A wise selection of the type of punch, of the size of the punch, the quality of the punch will determine the rate of transaction, the rate of wastage of grafts. Quitting or seriously limiting the habit of smoking before a hair transplant procedure is to be done is very essential because smoking impacts the health of the skin. In smokers, the incidence of scalp necrosis is high. And to this, if you add diabetes, there is high chance of skin necrosis, increasing the side effects of hair transplant with poor graft survival. Smoking not only causes reduced blood circulation, reduced oxygen supply to the follicles, it also adds the risk of skin necrosis. So encouraging patients to restrict or quit smoking will go a long way in favorable outcomes. Robots in all fields where they've been used, medical or non-medical, have cut down costs tremendously. However, in the field of hair restoration surgery, surprisingly, the costs of doing a robotic hair transplant are almost 4 times greater. And this, my friends, is a second reason why robots in hair transplant surgery are not as popular as they used to be, say 5 or 7 years back. And the first reason is that robots today, with the skills available to them, with their programming, still cannot do procedures better than the human. But they are touted to do precision surgery, to do surgery without the help of a human being. So why has the hype around robotic surgery in hair transplant died down? The answer is not hard to seek. Robots have been a colossal business failure in the field of hair restoration surgery. Clinics that once used them no more. But it continues to be a valuable advertisement too. Hair transplant still in 2024 continues to be a skill-based surgery. Robotic skills still need significant amount of improvement before they can rival human skill and human planning. So scarring is a concern in hair transplant surgery, in bad hair transplants, and also the scarring varies from technique to technique. Patients do not want to get FUT hair transplant because of the linear scar. Some FUE hair transplants also have very bad scars when the procedure has been done by untrained staff. So when you talk about hair transplant, scars are everywhere. Techniques like FUE hair transplant, if properly done, are minimally invasive procedures which leave minimal scarring if you use the appropriate size punch, do not do over harvesting. Proper surgical technique, proper post-operative care, and patient education on scar management go a long way in obtaining satisfactory outcomes. After all, nobody wants to trade one problem for the other. You have come for an aesthetic solution and you do not want to end up all scarred. So how bad hair transplants can be, you can see in this link. Lab tests are important in diagnosing the cause of hair loss other than androgenic alopecia, because androgenic alopecia is staring you at the face because it is symmetrical. It follows the pattern of androgenic alopecia. The hair in the donor area are normal. It's only the hair on the top of the head have gone. The skin is normal in condition. The patient is healthy. Tests are important in knowing the hormonal status of patient because androgenic alopecia is related to your hormones, is related to DHT. And DHT blockers, in an effort to stop the progression of baldness, should only be started after assessing the hormonal status of the patient to minimize side effects appearing in future, leading to poor patient compliance. There are times when a scalp biopsy may be needed, especially in cases of alopecia areata, cicatricial alopecia, and some other skin conditions. Ugly hair transplants gone wrong, bad hair transplants, can result from a host of conditions. Poor surgical technique is one. Inexperienced surgeons, unrealistic expectations from the surgery by the patient, improper case selection. These can lead to unnatural hairlines, low graft survival rate, poor growth, and worst of all, visible scarring. Preventing and addressing such outcomes requires a skilled surgeon, proper patient selection, and setting realistic goals. A corrective surgery in the right candidate may be necessary to improve the ugly results. This emphasizes the importance of choosing a qualified hair transplant surgeon. Nobody wants the hair transplant to end up in a horror story. Better to get it right the first time than cry over spilt milk. Let your hair transplant be the end of your problems, not the beginning. Get it done once, get it done right. The vertex or the crown area is a common area of baldness, androgenic alopecia. Restoring hair in this area may be challenging because of the presence of the vole pattern, the pinwheel pattern. In a background of extensive baldness, limited donor hair availability. Effective vertex restoration requires careful planning, understanding the way hair grows in the crown area, and strategic placement of limited number of grafts. Achieving a natural look in the crown area is a key goal in hair transplant surgery. It requires expertise and precision. Now, whey protein is a popular dietary supplement known for its high protein content and benefits for muscle building and repair. For individuals with hair loss and those undergoing hair transplant surgery, though adequate protein intake is essential for healing and promoting hair growth, supplements like whey and other protein supplements like creatine can further enhance hair thinning and speed up your baldness. Also, hair transplant results can be affected by whey protein intake on a regular basis. And the same is the case with prolonged anaerobic exercises, staying out of breath for a sustained period of time, say 30 minutes, not alternating aerobic exercises with anaerobic exercises. You're most welcome to do anaerobic exercises, but it should be interspersed with adequate amounts of aerobic exercises as well. And this I have covered in this video. Case selection is crucial. You cannot go around doing hair transplant in everybody. Everybody is not a suitable candidate. In my clinic, of 10 people who approach me for a hair transplant procedure, I have found that about 3 people are fit for the procedure. The others are not fit or not prepared at the moment for a hair transplant. They will have to first undergo medical treatment to stabilize the hair loss before they can be made candidates for hair transplant. They are eligible for a hair transplant. But there are a large number of patients who are just not candidates because there's a significant mismatch between the baldness and graft availability. Also, because of the age, they might not be fit candidates for the moment. And lastly, a hair transplant is considered a mundane, humdrum, repetitive maneuver done by the surgeon and his team day after day with back-breaking tedium. After a while, when the surgeon has been doing procedures for a long period of time, many years, he enters a state of calm attentiveness in which his actions are guided more by intuition than by conscious effort. The surgeon now becomes one with the procedure, lost in the rhythm of the task at hand. So well, that was the talk for the day. I hope for the beginner, it has made the field of hair restoration surgery a bit clear and giving them enough fodder to research more, to research topics which are more close to their heart, which they're seeking answers to. But if you still cannot find an answer, leave a comment in the comment section below and I'll get back to you. For personalized consultations, send me pictures on the WhatsApp numbers above and we'll respond back to you soon. Have a nice day. Hope you enjoyed the video. God bless you.